I would say the practical tips. Number one, open a line of communication with your healthcare team. No question is stupid. It is so important to know that. It's just okay to ask questions. If you're in the exam room, if you're talking to your healthcare team and you feel that your questions are not being answered, you feel you're being dismissed, please go see somebody else. And the reason I say that, by the way, is because the journey of cancer is not going to be always smooth. You're going to have some tough time, you're going to have some great times, and you're going to hopefully emerge winner on the other side. But to get that, you're going to have some obstacles. And if you're not even getting your answers questions to start with, how are you going to get your questions answered later on? That's really important. So, open line of communication, understand no question is stupid. Feel free to ask questions. And the three questions I would say you should ask is number one, why did I get this cancer? Probably the most common question you get asked as an oncologist. And the first chapter in my book is what is cancer and what causes it. Number two, I think it's an important question to ask, is it okay to sequence my tumor? Can we send my tumor for genomic analysis? The third question, from a practical perspective, are there any targeted therapies that we can use for my cancer versus the traditional chemotherapy that we normally use, where it doesn't really target a particular area in the tumor, it just targets everything. So these are the three practical questions to ask, and I do think they're important. It hopefully leads to better answer and more open conversations, but ultimately you need to feel empowered. I think patients inherently, they're overwhelmed, but they're also afraid of bothering you as a doctor. Well, that's your job. Otherwise, you shouldn't be in the profession of medicine if you're going to be bothered by questions. And number two is they're afraid that the questions are silly or stupid. There's no such a thing. This is your health. Everybody who's listening to this, and thank you for doing this show. This is the type of show everybody should listen to. Should feel empowered to ask any questions.